Okay, thank you very much, my channel families. Uh, in previous slide on the part one on stroke, we have seen about the definition of stroke. We have seen about the types of stroke, and we tried to cover also the risk factors. We classified risk factors as the non-modifiable and modifiable risk factors, and we have seen in fact about the mechanisms of each types of stroke. And finally we wilded the session with discussing about the anatomy, the anatomic classification of the brain based on its arterial circulation. We have seen that there is especially the anterior circulation, posterior circulation, and the middle cerebral artery territory circulation, which is part of the anterior circulation as well. So in today's session, we'll try to see about the important clinical features and the symptoms as well as the diagnosis of stroke. So please, I want to ask you to subscribe my channel, and please try to share to others so that I can do more medical videos, and I will continue with more lecture series on different body systems about medical lectures. So with this, let's start the second part of lecture series on stroke. We'll try to see about the clinical features, as we said earlier. So one of the common presentation for stroke is patient might present to you with sudden onset or numbness, sudden onset of weakness or numbness. So the weakness could be either the upper extremity weakness or the weakness of lower extremities or numbness to certain parts of the body. The patient may tell you, even sometimes the patient may present to you with just sudden falling down on the ground due to weakness of their extremities as well. The other important symptom that the patient might tell you is difficulty of speaking or understanding. So they might present to you with a slurred speech or totally unable to speak or difficulty of understanding what you are speaking. And the other important symptom the patient might present to you is visual disturbances. Patients might present with total blindness, sometimes with partial blindness or defects in the visual fields. In certain parts of the visual field could be blind. So visual disturbances is one of the common presentation of stroke. The other important presenting complaint could be loss of balance or coordination. So if a patient present to you with loss of balance, loss of coordination, and sometimes with vertigo, most likely you have to think about the posterior circulation stroke. So most of the time patients with posterior circulation stroke might present to you with a loss of balance or loss of coordination, or they may tell you vertigo or dizziness. So sudden onset of vertigo or dizziness or coordination loss could be the presenting symptom of the patient. The other important presenting complaint might be facial deviation. The patient's face could be deviating to one side of the face, so they might tell you that sudden onset of facial facial drop to the other side could be the important presenting complaint. So uh, when you see the stroke syndromes, as you know, syndromes means it is a constellation of signs and symptoms. It's a accumulation of signs and the symptoms. You call it a syndrome. So patients with anterior cerebral artery circulation, the presentation is likely with leg weakness, predominantly pronounced when it's compared with the arm weakness. So in anterior circulation, anterior cerebral artery stroke, you expect the leg weakness to be more pronounced as compared to the arm weakness. In the case of medial cerebral artery circulation, you think the patient's face and the arm, the weakness is more pronounced on the facial and arm areas as compared to the lower limb or the leg and aphasia. The other thing is posterior cerebral artery circulation stroke, which patients might present with visual field defects. So either total loss of vision or the visual field loss in certain parts of the visual field could be the presenting symptom of the patient in posterior cerebral artery circulation stroke. The other important thing to discuss is about the differential diagnosis for stroke. So, patients with hypoglycemia might present with symptoms that mimic stroke. So, a stroke patients by themselves, they could be hypoglycemic by themselves, or the hypoglycemia by itself might mimic stroke. So you have to search for any possibility of hypoglycemia, whether the patient had been taking oral hypoglycemic agents or insulin, or you have to take history about the meal history about the patient, whether the patient has taken a meal in the recent times or not. The other important differential diagnosis that you have to think in your mind is seizure. So sometimes seizure disorder might mimic the symptoms of stroke. So you have to think about is this a seizure or a stroke. So there is what you call Todd's paralysis. Todd's paralysis is it is a post-seizure weakness of the body. So after a seizure episode, patient might have present with weakness of certain parts of the body, so that may mimic stroke. You call that Todd's paralysis. So you have to think this patient might be mimicking stroke. So you think in that manner. The other thing is migraine. Patients with migraines also may mimic some features of stroke. So migraine headache is also possible differential diagnosis for stroke. The other thing is brain tumor. Patients with brain tumor, due to compression effects in certain parts of the brain, they might present with weakness or other neurologic deficits to certain parts of the body. It could be visual loss, it could be weakness of one or two arms, or sometimes unilateral body weakness could be possible due to compression effect on the brain in certain parts of the body. So you have to think about brain tumor. The other important differential about stroke is functional disorder. You have to think about functional disorders that could mimic stroke. So it is important to think about different differential diagnoses when you entertain with a patient in whom you are suspecting of a stroke. So when you see the clinical evaluation of the patient with stroke, your history and physical examination is very important. As usual for any medical condition, as you know, medical history taking, thorough history taking, and thorough physical examination that is very important. In fact, very crucial for your diagnosis to narrow your differential diagnosis as well as to reach your top diagnosis. You need to take clear and deep history, as well as you have to do important neurologic examinations. So you have to do all the neurologic examinations, and as well other body system physical examination is also very important, because for example you can take like patients with cardiac abnormalities might present with cardioembolic stroke. In such cases, if you do not do cardiac examination, you may miss the cardioembolic stroke, the origin. So the patient might have cardiac findings like atrial fibrillation. The patient might have murmur in the heart that may remind your mind for in possibility of cardioembolic stroke. So it is important to do almost all body system physical examinations so that you can be more genuine in your diagnostic approach. So the other important thing when you are dealing in a patient in whom you are suspecting of a stroke is brain imaging. Brain imaging plays an important and significant role in a patient management with hemorrhagic as well as ischemic stroke, because uh, before starting most of the managements, you have to see the imaging, especially the brain CT scan, which is because taking when you compare the brain CT scan with brain MRI, you get the result of CT scan more fast, and it is more in terms of cost wise, as well as in terms of time it takes. CT scan is more preferable when compared to MRI. That, so the initial and the first line modality of test for any patient who is suspected of stroke should be non-contrast brain CT scan. Non-contrast, the first line to rule out hemorrhagic stroke. So don't forget that the first line of brain imaging modality to do for a patient in whom you are suspecting of a stroke should be non-contrast and brain CT scan. So MRI is more sensitive for ischemic changes, especially early ischemic changes are not visible on CT scan. So MRI is more sensitive for ischemic changes and ischemic stroke. CT angiography and MRI angiography evaluation for the evaluating of the vessels. Angiography is very important. So could be the especially the vessels. If you are thinking of cardioembolic stroke as well as thrombosis, evaluation of the vessels is also very important. The other thing is you have to do important blood tests. Important blood tests in a patient you are thinking of stroke and you are and the patients in confirmed of stroke diagnosis. In fact, imaging, brain imaging, and brain imaging is enough. Brain imaging plus your history and physical findings are enough to make the diagnosis of a stroke, whether it is hemorrhagic or ischemic stroke. So the other thing, laboratory tests that you have to check is CBC. In CBC, as you know, there are three cell lines. There is WBC, there is RBC, there is platelet count. So from this, the platelet count is very important because if a patient has brain hemorrhage, that this group of patients, if there is the platelet count is low, so the risk of bleeding is high. So you have to check the platelet count in a patient with hemorrhagic stroke in your way of searching the cause of the bleeding. The other thing is coagulation profile. The same scenario is true. You will be more sure of what is the cause of the bleeding when you are sending for coagulation profile. The other thing is blood glucose, electrolytes, ECG, echocardiogram, and the carotid Doppler. Especially for a patient with ischemic stroke, ECG, echocardiogram, and the carotid Doppler are very significant because these investigations are very important. They tell you whether there is a possibility of cardioembolic stroke or not. The echocardiogram shows you whether there is vegetations in the cardiac valves or there is valvular abnormality, whether there is ejection fraction abnormalities in the heart. Does the patient has undiagnosed cardiac problems? Echocardiogram tells you a lot. ECG tells you whether the patient has patient might have atrial fibrillation, which is not diagnosed, and carotid Doppler also shows you whether there is carotid arterial abnormalities like atherosclerosis in the carotid artery that could be the possible cause of embolism and thrombosis. So you have to do all these laboratory investigation tests. So this is the brain imaging. Yeah, you see, it is the CT scan of the brain. The image that you see this on the left side, this image is it shows you a massive infraction. You see, this is the infract part. This is there is massive infraction on the right side of the brain. Here you see, and on the left side of the I mean on the right side of the slide, on the right side of the slide, the screen, you see that this is the hemorrhage, the white part. This white is the hemorrhage. This is intraparenchymal bleeding with surrounding brain edema. This shows you the brain edema which is surrounding the hemorrhage. You see, this is there is the white part is the hemorrhage, the bleed in the brain parenchyma, and surrounding this somewhat the grayish thing is the brain edema due to compression effect of the hematoma. So this is the brain CT scan of ischemic stroke and the hemorrhagic stroke. So this is all about part two lecture series on stroke, and In our next presentation, we will try to see the part three, which mostly involves the management part of the stroke. Thank you very much. Please subscribe, share, and like my videos. Thank you, my channel families. I want to say thank you again and again.